What are the negative effects of electronics on children? A question from one of our followers. Now, this is a big problem these days with kids spending hours and long hours on electronics. It could be a PlayStation, a PC, or a phone. And that has a lot of negative effects on the child. I divide them into two categories: somatic, which is bodily effects, and we have also the mental effects or cognitive effects. Now, with the somatic, when the child spends long hours on electronics without moving, without exercising, that increases the risk of obesity. And obesity in children is a huge problem and opens the door for them to a lot of complications in the future. Now, spending long hours, especially with wrong posture, the child sits on an iPhone or a phone or on a PC or a PlayStation with the wrong posture, that increases the risk of back pain, neck pain. We have kids 10 years old that come to us with back, neck, and neck pain, and that is from sitting long hours with wrong posture. Now, also with headaches, that sitting on electronics increases the risk of headaches. It could be migraine headaches, or it could be a trigger for migraine headaches, or it could be tension headaches. Also, it increases the strain on the eyes because you have a bright light in your face for long periods of time that affects vision and affects also strains the eyes and contributes to tension headaches. It can also, especially kids who hold the phone the wrong way for long hours, it can even cause carpal tunnel syndrome. So all of those are predominantly somatic effects of negative effects of electronics on children. Now we move to the other effects. Now there are the main effect that people or kids who spend long hours, it prevents them from the correct social interaction because the child spends long hours by themselves, and that takes them away from people around them, and then the social interaction becomes abnormal or becomes limited. There are some studies that have shown that kids who spend long hours on electronics increases the risk of depression and anxiety. Also, some studies have shown that electronics can affect attention span and concentration on kids, and that affects their performance at school too. Also, now there are some studies that have shown that electronics affect the sleep and causes sleep problems because the light from the electronics is a stimulant, so the child have difficulty sleeping and can cause insomnia. And of course, some children will spend hours on the phone and they want to avoid to go to sleep so they can spend more time on their electronics. And that can cause a sleep deprivation. Sleep deprivation has a lot of consequences on the kids. And finally, it also affects the immune system and lowers immunity. And some studies have shown that spending a long time from kids on the electronics can lower their immune system and increase the risk of recurrent infections. So how do we deal with it? Number one, limit the hours that the child spend on the phone or on electronics. Any children below age 2 should not be on, or 18 months should not be on any electronics. Between age 2 to 5, they should spend 1 hour, and it should be on educational programs. Now, after age 5 and up, they should limit it to maximum 2 hours. And also, you should limit what the child watches, because typically if you leave them alone, they can be exposed to a lot of things that they should not be exposed to. And now get involved with your children, take them out, register them in sports programs or educational programs that takes them away from the phone and limits the amount of time that they spend by themselves in their rooms. All of those can help prevent or lessen the amount of exposure of electronics to your child. Thank you.